We offer biomarkers for the risk assessment for different chromosomal abnormalities, mainly in early stage of pregnancy. It is very important to underline that screening is different from diagnosis. As a result of screening, we offer to patients a certain risk to carry a baby with Down syndrome or another chromosomal abnormality. And based on this individual risk, the parents further have to decide whether they want to go for invasive testing or not. The goal of screening is finally to reduce the number of invasive testing, because every invasive test carries a certain risk to lose a healthy baby. And we focus on first trimester screening, it's our special focus, week 11 to 13, but we also offer assays for the second trimester screening. The prenatal screening is not only based on biomarkers, it is based even mainly on an ultrasound marker, on the so-called nuchal translucency. The nuchal translucency is a collection of a certain fluid behind the neck of the fetus. It is very difficult to measure. The other markers influencing the results are maternal serum markers like free beta-HCG, a special form of the pregnancy hormone, and B.R.A.H.M.S. Both these assays run on our cryptor. By the way, B.R.A.H.M.S was the worldwide first automated B.R.A.H.M.S assay available. And the third important factor is the correction of those measured nuchal translucency and both biomarkers by maternal parameters like ethnicity, smoking habits, previous pregnancies, and others. And at the end, a risk calculation software has to be used to calculate the individual risk for the mother-to-be. Precision of biomarkers is directly linked with the safety of the result. It is essential to have precise markers, especially in terms of lot-to-lot stability. The fact is that calculating the individual risk, we use an equation and we multiply all these factors together. And every factor measured has a very small mistake. And calculating them all together, multiplying the mistake will be great at the end. So it is very important to use biomarkers with the highest precision, because the precision of the biomarkers will essentially influence the precision of the final result, meaning the final risk. Good quality, good precision in terms also of long-term stability of the biomarkers adds certain safety to the results for the parents. And here, the Nobel Prize winning technology of the cryptor assays offers special advantage, because we are not in need for any separation or washing steps like in almost all other technologies, and therefore we are able to offer very precise results. And also the fast of the result is important, because like in a kind of a counseling of women in OSCAR setting, which means all the counseling has to be done in 1 hour, this is necessary then to have fast results, and we can offer the results within 19 minutes. OSCAR, by the way, means one-stop clinic for assessment of risk. This screening is not based only on biomarkers. A very crucial role plays a special ultrasound marker, the already mentioned nuchal translucency, and also some other markers added by the ultrasound specialists nowadays. It is very important that these ultrasonographers have special skills and are especially trained and certified and regularly audited for the high quality of the measurement, because we speak about very small variances between the normals and the affected pregnancies. We offer also a CE-marked risk calculation software. The name is B.R.A.H.M.S Fast Screen Pre-1 Plus. The software is meant to allow risk calculation for first and second trimester. It is important to notice that for the use of the first trimester module, you have to have a license key. This license key you get after a certification process from the specialist organizations based on advanced training and education and practical experience to secure the high quality essentially for the safe results for the parents to be. And it is a fetal medicine foundation and its branches which ensure that the ultrasonographers and also the laboratories put these demanding quality standards into practice. This certificate as mark of quality distinguishes between doctors or laboratories and offers the parents added safety. Tumor markers can be any substances like hormones, peptides, proteins, which are correlated with tumor growth. Tumor markers are used and are powerful tools for therapy control and patient follow-up during the course of disease. Tumor markers, due to their low specificity, are not meant to be used for screening or for diagnosis of tumors. Of course, there are differences between the tumor markers used in different cancers. For instance, in the case of a colon cancer, you would use a CEA, carcinoembryonic antigen, as a tumor marker of first choice, and you might add a tumor marker like CA99 or chromogranin A as marker of second choice or as additional tumor marker. The combination of the tumor marker depends strongly on the histology, the histological origin of the tumor disease. By the way, chromogranin A, provided by our company, is the first automated tumor marker, chromogranin A, for neuroendocrine tumors worldwide. As it was already said, they are used for follow-up, for therapy control in once diagnosed patients. So ideally, you would measure the first tumor marker before the therapy of the tumor disease starts. But more often, the measurement of tumor markers starts after primary therapy, what would be the surgery and the removal of the tumor disease. In those cases, tumor markers elevated before fall down to quite low values near to the median or the values of the normal population. And these low values are called the baseline. Starting from the baseline, once established at the beginning of the therapy, you follow up the deviation in the tumor markers by serial measurements, meaning tumor markers are measured with every follow-up visit of the patient by his doctor. It is very important for an accurate follow-up of the tumor disease that the tumor markers are very precise. Again, the already mentioned lot-to-lot stability is of highest importance because change in the level of the tumor marker during the serial measurements has something to do with the change of the course of the disease and not simply because a new lot from your provider arrived to the laboratory. So it is very important to produce very, very stable. It's important for the safety of the patients. The Thermo scientific crypto systems provide exceptional precision and reproducibility based on the already mentioned trace technology, which is unique. Additionally, crypto systems are fast and easy in handling. The trace technology, as already mentioned, does not need separation steps or washing steps. The technology itself is responsible for a very much reduced imprecision of the assays, very low imprecision, and allowing to use our tumor markers as a real powerful and safe tool in the therapy control and follow-up of cancer patients. The third area I am responsible for are the thyroid assays. And I think the mostly known and famous assay from that area is TRAC, the so-called TRAC-human. This is an autoantibody test for the TSH receptor. The TRAC assay is well accepted as a gold standard for the diagnosis, differential diagnosis, the prognosis, and also for the severity of disease and endocrine eye disease due to the exceptional sensitivity and specificity. The sensitivity is near to 99% and the specificity is near to 100%. So this is a really diagnostic test. Graves' disease is an autoimmune disease, as I said already, and it's the most common reason of hyperthyroidism, meaning that the thyroid gland is overproducing their hormones. It is very important to have a very safe diagnosis on that because there are also other reasons or causes for hyperthyroidism, like autonomy. Graves' disease can be cured in 50% of the patient by a drug therapy. Autonomy, for instance, has to be treated only by surgery or by radiodiodine therapy. It's very important to have a secure and safe diagnosis. And this assay, the TRAC assay, TRAC Human, is now available on automated on Crypto. We are really proud to be recognized as a relevant partner from scientific communities and from partners driving the research and the development in the 3 fields of diagnostics I have mentioned before. So we have a close collaboration with the Fetal Medicine Foundation in London and also with some branches in other countries. We are well recognized and have traditionally long relationship with the scientific community on thyroid diseases. And also the development of our new assays, quite often done in close collaboration with famous clinics or research units. For instance, chromogranin A on Crypto has been developed together with the Mayo Clinic. The last but not least, the close collaboration with our colleagues within Thermo Fisher Scientific allows for further and even more effective development of new diagnostic assays to increase and improve the safety for our patients.
Thermo Fisher Scientific products are distributed worldwide. Not all intended uses and applications mentioned in this video are registered in every country.